All right. Well, 6 o'clock, and I still see some people getting on, which is awesome. This is definitely a topic that we've gotten a lot of registrations for and a lot of interest. So hopefully it should be a good one for everybody. So I'm gonna get started, and yeah, it's just good to see you guys. Hey, Allison, good to see you. All right, so I'm going to talk about SIBO, and this is actually a lecture I've given to doctors, and this course I actually give a 2-hour presentation, and that's not even enough. So I'm going to give a condensed version of SIBO and try to give you guys as much information as I have around this topic. I think what's great about doing the webinars and why we do them is it's also content that you guys can go back and watch and look at. So you can go to our YouTube channel. So we've been putting all the webinars on our YouTube channel so that you guys can go back and watch, and then you can look at the other webinars as well. So this is a big one. And this is a topic that when I was in practice, nobody talked about SIBO. Which is small intestinal bacterial overgrowth. So I'll try to interchange that just in case people show up late. But usually if people are signing up for this course, they probably know what SIBO is, or they're really curious to learn more about it. But yeah, when I started early on back in, oh my gosh, I've been in practice now 17 years. So when I first started, there was no mention of this. And I remember when I was asked to teach this, they said, hey, will you teach it, and learn about it? And so as I was learning about it, I was like, oh my gosh, this is a lot of people that I wish I would have known this information years ago. I would have been able to help them. So it's been an interesting journey kind of learning about SIBO. When it first came out, it was basically like, here's the protocols, and everybody followed a protocol. And then as more information kept coming out, it was like, well, those protocols don't really work. Try these protocols. Well, that test doesn't really work. Try this test. And so it keeps evolving, which is good and frustrating. And I think that's kind of how this topic is. This topic is kind of a frustrating topic for a lot of people, and is actually a very frustrating topic for a lot of practitioners as well. So that's why we're going to talk about it. And I'm basically just going to verbal dump all my information that's in my head about this, and then we'll go from there. So yeah, if you guys have questions, definitely you can shoot those questions, and I'll try to answer them as we go along. So we're going to talk about 3 signs of SIBO. Honestly, there's a ton of signs that you might have SIBO, but I want to give you some of the kind of the more common ones. But basically, this is just your title. I'm just going to talk about SIBO. Let's go. Let's have fun. Ready, set, go. All right, so about me. So if you don't know much about me, so I have my board certification in neurology. So I'm a chiropractic neurologist, chiropractic nutritionist. I've been in practice for 17 years. And really my practice, what I've done over the years is I've really combined neurology and functional medicine together. And I think that's what makes this clinic really unique. There's not too many clinics that do this. It's taken a lot of training and learning and seminars and speaking and researching in order to do that. But that's kind of what we're doing. So now we're even getting more into that interdisciplinary clinic. So we have a nurse practitioner, nutritionist, counselor, doctors, therapists, staff. So we're really trying to combine all these worlds together. And honestly, when you get into topics, even like SIBO, you kind of have to combine these worlds. And I think that's what you're seeing with some of the docs that are really successful, or ones that know how to combine all these different worlds together. So I know a lot about immunology. So there, one of my mentors is an immunologist. Another mentor of mine is Dr. Karazian, and another mentor of mine is Dr. Carrick. And so there's a lot of docs that I look up to that I get to ask questions, and this is how I've kind of developed the practice. So that's a little bit about me. All right. So what is SIBO? So SIBO is small intestinal bacterial overgrowth. And what this is, and so I'm going to try to work on the physiology and the mechanisms first. In the lower intestinal tract, you have bacteria, or you have your natural flora. And within that bacteria, you have what's called like gram-negative and gram-positive bacteria. And they all do different things. Now, if you have heard the word microbiome, it's a word that exploded about 4 years ago now. And when it exploded, it just changed how we think about the digestive tract or the gut. And so the microbiome is really understanding how each of the bacteria in the digestive tract have specific roles on health. So there's certain bacteria that are related to depression. There's certain bacteria that can be related to mental health disorders. There's certain bacteria that can be related to multiple sclerosis, and et cetera, et cetera. So these bacteria, they live and they're happy and they're peaceful in their environments. But what happens is that there's a decrease in motility, or a decrease in transit time, or a decrease in the speed of how things move through your digestive tract. So usually when you eat something, it should kind of go in and out in about 18 hours, and that's called your transit time. So a lot of times doctors will talk, or if you read research, you'll hear research on an increased transit time or a decrease in transit time. Sometimes a really fast way of measuring it on yourself is you can eat something that's really difficult to digest, like almonds or corn or things that have cellulose, and then you can see how long it takes to go through your system. So if something takes more than 18 hours, that could be a decrease in transit time. And if that something speeds up and you're passing it within the day, that's probably way too quick. But in this instance with SIBO, what happens is you got these really cool bacteria that are doing their job. They're hanging out, and they, your microbiome's there for you. But your transit time decreases for whatever reason. And that's what we have to go through, is kind of all these different causes. But for some reason, the motility goes down in your gut. So now these bacteria have the opportunity to go upstream. So they can never really get upstream because the speed or the transit time always pushes the bacteria back down towards the bottom. But you have these instances where you have a slowness of your speed. So the bacteria are excited and they say, you know what? We can go up there. It's like, there's the promised land. You know what's up there? There's food. There's so much food for us to enjoy. So with this decrease in transit time, these bacteria, they start to migrate, okay? And when they migrate, they go from the large intestines into the small intestines, and it's called small intestinal bacterial overgrowth. And so when they're up there, it's a party. So everything you eat, they get to also enjoy. So they get to break down, fruits and proteins and starches and fibers. And when they break these down, or they're utilizing them or consuming them, they release gas. So there's two different types of gas that the bacteria will release. And there's actually more gases. There's different types of gas. But the two more prominent gases that are released is methane and hydrogen. So methane gas, so both of these gases will cause bloating. So usually people talk about bloating that's underneath their stomach, underneath their rib cage. So this is not bloating that's down by their stomach, but this is more up high. So this is the bloating that people talk about. Now, methane gas, if you have a predominant bacteria culture that produces methane, it actually causes constipation, which is not good because that just increases the amount of translocation of the bacteria up into the small intestines. If you have hydrogen gases, those actually can cause diarrhea. So those cultures will tend to cause loose stools. So people can complain of constipation and diarrhea, and it can all be related to SIBO. However, you can also have a mix of the two cultures. So you can have both bacteria that are producing both gases, and so now you have mixed. And so these are people that will tend to talk about constipation and diarrhea. Okay, so this is important because you hear this all the time. It's like, well, I have diarrhea, I have constipation, I have both. My doctor diagnosed me with IBS-C. My doctor diagnosed me with IBS-D. My doctor diagnosed me with IBS-M. And so all these things are just pretty much telling you you have IBS. Now, IBS is kind of like a little bit of a catch-all diagnosis. And I actually did a webinar on IBS months ago, but IBS is kind of a catch-all. So a lot of times you hear this, well, I have IBS. I'm like, well, great. What's causing your IBS? That doesn't really help me too much. So that kind of becomes like this catch-all. We don't know, but it's irritable bowel syndrome. So SIBO actually is kind of a big, big deal when it comes to irritable bowel syndrome. And so we're going to talk about that a lot more. So I'm double checking. Hold on. So, so to kind of move on from there, sorry, I got two things going on at once, which is always good times. All right, so we're gonna let me move on now. All right, so let's talk about causes and factors because we talked about how SIBO is really when you have the migration of bacteria that go from the large up into the small, and usually that occurs when you have a decrease in motility. So now we have to say, well, what causes that decrease in motility? Because this is actually the difficult part with SIBO. So, like I said earlier, it frustrates patients to no end, and it also frustrates the doctors to no end because the causes can be one, they can be two, or they can be 10 causes. All right. So I'll start from the top and I'll kind of give you some different pieces. So hypothyroid is actually a really common cause because people that have hypothyroidism actually have a decrease in motility naturally. So one of the common complaints that you hear with people that have hypothyroid is constipation. Okay. So if you have constipation and you have decreased motility, well, then you have a potential to have SIBO. Stress. Stress also decreases motility because stress is a fight or flight mechanism, and your digestive or your gut is a rest and digest. The two, for lack of for simplicity's sake, they can't really coexist. So if you're always in a stress response or a fight or flight response, then your gut function goes down. And this is where you see even leaky gut with stress. You see constipation with stress. You see all sorts of issues with stress that everybody's pretty much aware of. But you can have a chronic stress response that's also causing SIBO. This could be trauma. This could be a car accident. This could be a divorce. This could be a loss of job. This could be losing a family member. This could just be family stress, work stress, personal stress. There's a lot of stressors that we have in our life, and most people have in their life on a pretty daily basis. Certain medications can also lead to that. And then food allergies, because if you have inflammation from a food allergy, well, then that allergy can disrupt and cause inflammation, which can create stress, create an adrenal response, and that can also lead to your decrease in motility as well. Then we look at hormonal imbalances, things like estrogen. I mean, you can get as far as like having things like endometriosis, but you can have progesterone, estrogen imbalances that can also cause disruptions in gut function. The next one is infections. So infections like viruses, and actually a ton of infections. We can talk about parasites. We can talk about bacteria. We can talk about candida. We can talk about other viruses. And there's actually GI tests that can run and look for different pathogens, but even infections can definitely cause some of these slow motilities. Finally, diabetes. So people who have diabetes, this is also another big factor that they've actually kind of shown that goes back and forth with SIBO. And in diabetes, definitely you heal slower. So if you know a diabetic, they tend to heal slow. The growth of their nails is slow. Their skin is slow. So everything is kind of again sluggish because diabetes affects it's a very inflammatory condition, but it also impacts like those small nerves and the small arteries. And so those nerves and arteries provide blood flow and activation into the gut. And so if you're kind of messing up those like little teeny tiny nerves and arteries, you can create ischemia in the gut, and you can also have some digestive issues that are in the gut. Crohn's disease is probably the most common autoimmune condition that's associated with SIBO. And then finally, leaky gut. I put that in there because a lot of people have leaky gut, and there's a lot of that around. Now, leaky gut is a whole nother story that you have to say, well, what's causing the leaky gut? And that's where you get back into hormone imbalances, thyroid, stress, medications, diabetes, all of it. So that's the hard part about this. So when I kind of start off and say, we got to find causes and factors, if you guys are working on these things, this is hard. Sometimes you hit the nail on the head and everything is amazing, everybody's happy, and it's glorious, and you love life. And then there's other times where you're like, okay, what's the cause? And you're like, well, we're working on the thyroid. We're working on the stress. We worked on hormones. Oh, but there happens to be this infection that may or may not be causing that we may or may not have found right away. And it just gets really, really confusing. So this is just kind of to help you guys, especially, those who have been, or on the YouTube channel watching, these are things that sometimes you can ask your doc. If you're working on yourself, you can kind of go back and take inventory. But the causes, and this is just a handful. There's a ton of causes that can actually play into this. And I think even one that I didn't mention was brain injuries. So they're showing a lot of research with brain injuries and concussions and strokes and neurodegenerative disorders that can lead also to SIBO. As a matter of fact, one of the early signs and symptoms of Parkinson's is chronic constipation. So it's really fascinating when you look at some of these neurological disorders or degenerative conditions. Actually, some of the earliest signs are gut issues. And then brain injury, they're really starting to do more research on brain injury and ulcers and brain injury and SIBO. It's just really fascinating. So the laundry list is long with all the different causes, and that's when it becomes a little bit difficult. All right, so we kind of talked about mechanisms. So there's kind of like two big mechanisms, and I added a third on there. But if you kind of look through the literature, if you're kind of reading different things, one of the mechanisms is a decrease in gastric acid. And so I kind of listed the three major things that you see with this. One is hypochlorhydria. What hypochlorhydria is, it's a decrease in hydrochloric acid, right? And then you have to say, well, what causes a decrease in stomach acid? Well, stress can do it. Hypothyroid can do it. Brain injuries can do it. And hormonal imbalances like estrogen can do it. And then stress is another cause, which we already talked about that. And then finally, H. pylori is probably one of the more common infections that you see that can also cause a decrease in gastric acid. So H. pylori is a bacteria that it burrows into the stomach lining, and it actually impacts what's called the proton pumps. And when these proton pumps are impacted, you can't produce natural hydrochloric acid in your stomach. So therefore, you can't kill off the natural bacteria. And another thing that people don't know is that hydrochloric acid is kind of the beginning of the chain reaction of digestive function. So if the very top of your stomach acid is not working, then it has an impact all the way down. So H. pylori can actually lead to hypochlorhydria. Stress can cause an increase in H. pylori, and those both can cause an increase in hypochlorhydria as well. If people ask, like, where do you get H. pylori, most common place to get it is from dogs. So, this is where you want to make sure you're not letting your dog, kiss you on the mouth and French kiss you, and you're not playing with your dog's toys and then eating dinner. Like, you can transfer H. pylori really easily. So dogs do well with it. They have a good relationship with it, but we don't. We have a natural amount of H. pylori, but we should have enough stomach acid to keep it under control. The next one is a decrease in motility. So we mentioned this hypothyroidism is probably one of the biggest things that I see in practice, and then followed by autoimmune conditions. So this could be an autoimmune, like Hashimoto's autoimmune condition, or lupus, rheumatoid, fibromyalgia, neurological autoimmunities. So autoimmune conditions really disrupt the immune system. And the immune system actually becomes another piece of why people have SIBO. So you can actually look at abnormal immune function, or you can look at abnormal T cell production. So there's B cells and T cells. So the abnormal T cell production can also cause a decrease in motility and lead to SIBO. And then finally at the bottom, I was talking about like the brain-gut relationship. So this is what I was talking about earlier with brain injuries, neurodegeneration, and then a decrease in vagus nerve. And the vagus nerve is at the very bottom of your brainstem, which is kind of way down in here. But the brainstem controls like your palate. Well, it controls a lot of things, but the lower brainstem controls your palate and your gag response, swallowing, and all those pieces. So the vagus nerve is kind of the connection between your cortex to your visceral system. So the vagus nerve activates gut motility. It activates absorption and enzyme production. It has an influence in the kidney and the gallbladder and the liver. So your vagus nerve is a really, really important piece of the picture. There was a really cool study that they did. I mentioned this on the radio yesterday, but they did this really cool study where they took mice and they induced a concussion in both mice. And what they did with one group is they actually kept the vagus nerve stimulated with the concussion that they induced, and then they looked at gut function. And they found that the mice that they kept the vagus nerve active and healthy, their gut function actually maintained itself. Where the mice that they didn't do anything with the vagus nerve, they ended up having digestive issues. So it's a really cool study just showing that brain-gut relationship. So every once in a while you hear somebody that has a brain injury talk about how they have all these digestive issues. Or if you're doing a history, they say, ever since my car accident, my gut has always been a mess. Well, that's your connectivity that we can start looking at with brain-gut function. So when you kind of go through the exam, this is what we do, and what we try to do is we go through and we try to figure out the histories. We try to look at timelines. We try to look at things like mental health incidences. Did you have a car accident, a brain injury? Do you have chronic stress? Did you have chronic anxiety disorder, PTSD? Some of these things can actually change how your gut fires and functions. And then we try to look at different lab tests like stool testing. Can we run, it's called we run a Genova test where we can look at digestive health and look for infections. There's another company called Diagnostic Solutions that will help us look at different pathogens like viruses. Or is there imaging where somebody has diverticulosis, or they have an infection, or they have impaction or bloating. So there's different things that we can see on imaging, usually like a CT scan. And then we look at the neurological piece of it, because if we're looking at a brain-gut relationship, then we want to look at the brain component. So is there a history of some neurodegenerative disorders that are taking place? Is there something going on with the vagus nerve where it's not functioning as well as it should? Is there a history of brain injury, brain trauma, strokes that can also lead to gut dysfunction? So you're trying to incorporate this whole neurofunctional medicine, immune, gastrointestinal, and trying to pull these worlds together, because if we can figure that out, it makes life easier. And I say easier because that's what you're trying to get at with each patient, is that it can be really difficult. So if we can make this easy and trying to hit the nail on the head as soon as possible, then everybody's happy. And then there's times when you're like, okay, this is just not working, and you have to go back to the drawing board. So we'll talk a little bit about diagnostic testing. So I'll kind of back up a little bit. This is probably the most frustrating world for me. I wish that there was just great testing where you can just send a test off, it comes back, and you stamp it and you say, you have SIBO, you have this, we're going to do this, you're going to be better, we're going to rerun this test, and you're going to you're going to name your firstborn after me, right? And that is just not how this works. So let me kind of explain. So this is a breath test. So you kind of see two different breath tests that people run. We got a hydrogen breath test, that basically you drink a solution and then the bacteria release a gas, and that's what you're measuring, is that gas. The struggle with these tests over the years is that there could be some false positives, there can be some false negatives. Sometimes you rerun the test and it looks totally different than what it was. And I think more and more and more, I'm seeing that practitioners are just not utilizing this test. So I think there can be some benefits to it. And if you see a really high level, then you go, that's it. I think I figured it out. But that doesn't always seem to correlate beautifully. And so that's where the struggle comes into play. And especially sometimes when these tests come back negative and you're just like, wait a minute, everything points to SIBO. Why did the test say it's negative? And that's where it sometimes gets tricky and a little bit frustrating. So it's kind of an example of a SIBO breath test. Another thing that we can look at is a stool test. So this is by Genova. So we can look at different things where we can get an idea of how the person's digestive function is going, what's going on. So this person here, they got a little bit of malabsorption. But if we look at the next page coming up, then you can see that there's a lot of difference. So commensal is your normal flora. So if you look, you see this is high, 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 high. So there's 6 bacteria that are high. You have 1 that's low. So on one hand, you can call this dysbiosis. On another hand, this can also be a clue that maybe you got some overgrowth going on of bacteria in your system. So this is kind of another tool that we'll use to try to figure out if somebody has SIBO. So if they kind of have all of the signs and symptoms of SIBO, and this test looks something like that, you go, well, it's probably a really strong chance you have SIBO. So let's go down that road. Let's treat it as if, and then see how you do. Because if the breath test worked, that would be super awesome. So a little bit more. So we have different bacteria. So you can have pathogenic bacteria. You have your normal flora that can be elevated. So kind of here's your 3 signs. And these are things that are kind of like they ring bells in my head when people start talking about this. So one of the things is bloating that increases throughout the day. This is actually probably one of those things I wish I would have known back in the day, because I think I would have been a much better doctor to a lot of patients, because I heard this a lot early on in practice, and you're like, I don't know. And so you're trying to do things, you're trying to do this, you're trying to do that. And people come in and they go, I'm still bloated. And if they had a morning appointment, you go, well, you look great. I'm not too sure what you're talking about. And they're like, oh no, you should see me at night. I look like I'm 7 months pregnant. And you're like, okay, that's great. And so, you don't really get to see them all that often to see what they're talking about, but every once in a while I got to see it. So I remember particularly there's a patient probably 7 years ago, and I remember she loved vegetables. So she would eat, squash and zucchini and all these different veggies. And then she finally took a picture one day. She's like, here's my picture. And she looked like she was 7 months pregnant. I mean, it was pretty bloated. And I was like, oh, that's what you're talking about. She's like, yeah, every time I eat vegetables, which then throws me off at the time. Because I'm like, vegetables are good for you. They're not really a food allergy. So you run a food allergy test and she's negative. She's like, well, that doesn't make any sense. I just wish I could take this knowledge and time warp back to a lot of patients and go, you probably had SIBO. So if you get bloating that increases throughout the day, and then you go to bed, and when you wake up, your tummy is flat again, that's usually the most common thing that I hear with SIBO. Because you have breakfast and you get a little bit of bloating. Then you have lunch, you get more bloating. You have dinner, you get even more bloating. And then you don't eat all night. So then that bloating settles back down to start all over again the next day. So that's kind of like a big sign and symptom that you probably have SIBO. The other one is changes in stool. So you can have your diarrhea, you can have constipation, or you can have a mix of the two. And then the last one I put in here is kind of one that helps me out, and kind of that's why I say it's the three signs. So one of the things that I also wish I could go back in time was there would be times when I'd give somebody a probiotic, for instance, and I'd give them a probiotic, and they say, "Oh, that just made me worse. I'm bloated all the time. I look pregnant." And I'm like, "Well, that's weird. Like probiotics are good for you because that's what we're always told. Probiotics are great." Well, it kind of makes sense now that if you have a lot of bacteria and I add more bacteria to the mix, yeah, that's going to create more bloating. There's also certain herbs that they call like mucilaginous herbs, like slippery elm and marshmallow. Those type of herbs actually can feed those bacteria. So sometimes you're giving somebody a digestive supplement that's supposed to be helpful, and it works with every other person, but it doesn't work with this person. And usually that can be an indicator of SIBO as well. So there's definitely some herbs. There's some mucilaginous herbs. There's probiotics, and there's things that actually kind of tip you off that this is SIBO. So even some of the supplements that I'll give somebody, I'm like, this is great. This is the right path. And then you give it to them, and all of a sudden they get worse. And then you back up and go, oh, I think they have SIBO, and I'm totally missing that. So then you just shift, change gears and go down a different path. But if you kind of find that you're been in one of these boats, is probably a good sign that you have SIBO. But I would say the number one thing that I've seen over the years is bloating that increases throughout the day. Now, if you look at the signs and symptoms of SIBO, it's a really, really long list. So that's why I'm not putting that whole list in here unless I put it right there. So I put much more at the bottom if you notice that. So there's abdominal cramping, gas and bloating, constipation, diarrhea. There's sleep issues, anxiety, fatigue, malabsorption, weight loss. You can have a vitamin D deficiency, vitamin A deficiency. You can have a B12 deficiency. You can have nutrient deficiencies because of the disruption of absorbing those nutrients in your gut. So sometimes these are kind of clues where you go, man, you're not absorbing anything. You're bloated all the time. Your stools have changed. You're always fatigued, and you're losing weight. I mean, that could be a really big sign of SIBO. So this list is really, really long, but you probably had time to look at it since we've been talking. All right, so what do you do? So I think I try to put this in here because I think that's kind of the question. Everybody's like, well, what do I do about it? So we'll talk through some of those. So yeah, dietary changes is probably the biggest thing, but I'm going to give you some buts in the middle of this. FODMAP is probably your most common dietary change that you make with SIBO. So the bacteria primarily love to feed on fructose. So this is a low fructose diet. So sometimes you'll see a low FODMAP diet. So you're just taking a whole entire diet plan that people have put out there. You can find them anywhere, and then you just incorporate that into your lifestyle. Now, that also sometimes becomes an indicator that you might have SIBO. So sometimes patients come in, they're like, I'm doing this FODMAP and I feel amazing. You're like, oh, okay, well, that probably means you have SIBO. The problem with FODMAP, though, is you don't want to do a FODMAP diet for long term. So we see patients that come in here like, I've been doing FODMAP for 3 years, 5 years, even longer. When you do a long-term FODMAP diet, it can decrease what's called your short-chain fatty acids. And you need those short-chain fatty acids for the colonocytes or the large intestinal cells. So if you do a long-term FODMAP diet, then you've got to start incorporating short-chain fatty acids, because if not, you can end up with other digestive issues. And this is kind of where the newer research has been coming out for the past year or so. So you want to do FODMAP, but you got to figure out the cause, because you don't want to do FODMAP long-term. So that's one of the things that you can do. Now, obviously, you can also work on eliminating, your allergenic foods, your inflammatory foods. You can do things like paleo diets and autoimmune paleo diets. But here's my but. What we found over the years, which has kind of drove me crazy, was, you kind of learn that FODMAP for everybody with SIBO. But then as you kind of dive into working with patients, you find out that not all diets work the best with all patients that have SIBO. So this has become crazy making. So some patients do really well with FODMAP. Some patients do really well with paleo. Some people do well with a paleo modified to fit their food and what they can tolerate. So our big thing in the office, and this is where research has really been coming out for the past year or two, is you have to eat foods. You need to eat a variety of foods. So we kind of stopped following like the pure FODMAP and started saying, okay, how can we improve, or how can we increase the amount of foods that you're eating on a daily basis without causing issues? Because the vast differences of fiber, what they do is they support the microbiome, and that's what's important too. But we have to keep this nice balance. So these are some of the dietary changes, but they're not hard, fast rules. FODMAP is something you try. If it works, that probably confirms more that you have SIBO. So now we have to go back to the causes, and we have to start working on the cause. Supplemental support. So you'll see all sorts of different supplemental supports out there. I mean, you can go to all these different websites, all these different people who are experts in this, and you'll see all different types. I think even from a practitioner standpoint, it's super frustrating. So there are patients that do really well with, like certain different types of antibacterials. So you have probably the most common that are out there is called FC-Cidal and Dysbiocide. Probably the two most common supplements that most practitioners use. But I've also seen things with oregano oil and other berberine and other types of antibiotics. Hydrochloric acid or betaine HCl, that's one of them that we use, because that goes back to the hypochlorhydria piece. So if we can really support that HCl in the gut, well, that can also help to kill off some of the bacteria that's in your gut, so we can start moving them back towards the bottom. Now, there's SIBO-specific probiotics. So there's actually some really great research on that there are certain bacteria that are actually beneficial for people that have SIBO. And so there's actually supplements and things like that that you can utilize for people if you need to, A, give them a probiotic, but B, can also have support, around decreasing some of the SIBO symptoms. So it kind of goes against that whole like probiotic concept, but there's actually very specific strains that are good for SIBO. And then finally, there's things like prokinetics. So prokinetics is something that increases the motility of your digestive tract. So it helps to kind of speed it up and get it moving. So for instance, serotonin or 5-HTP can be a prokinetic. So we all think about it with depression, but actually a big part of neurotransmitters in your gut are serotonin based. So we can actually utilize serotonin or acetylcholine to help kind of speed up and to increase the transit time. And they call those prokinetics. Actually, in medicine, they actually do this as well. They use prokinetics and antibacterials, which I think we'll talk about in a second. So these are kind of an example of some of your supplemental supports. But there's also a lot of things that you would do. Like if somebody has thyroid issues, you can use supplements for that, or you can use medication. If somebody has a parasitic infection, then you can use things to kill off the parasites or kill off the candida, or work on the autoimmune Crohn's disease. So this is an incredibly small list of supplements because that can grow really big depending on what you're trying to accomplish. So these are some of the areas too to look at. So adrenals and cortisol. So you got to work on a stress response. So there's times that we need to give somebody adrenal-based supplements to help kind of get that system more supported. Thyroid. We look at things like conversion. We look at thyroid production. Some of you guys, if you listen to my other talks on thyroid, that actually 20% of your thyroid conversion takes place in your digestive tract. So if your digestion is not working, that's 20% of potential imbalances going on in the thyroid, which then can further perpetuate, this whole decrease in transit time and decrease in motility. And then we look at estrogen again, and we look at hormonal balances. Now, medications. So I kind of listed the most common medications that you'll see. And there's kind of a time and a place. And so kind of in our office, that's one of the things that I enjoy having is this time and a place. There have been some patients that I didn't need to use medications at all. And we use things like the dysbiocide, FC-Cidal, and we just hit it and we, kill it and things are much better. And then there's other patients that I could probably spend 6 months in trying to kill something with supplements. It's just not going to work. So I'd rather just do the medication, be done with a 10-day, program, and then start working on their gut. So kind of your rifaximin, flagyl, neomycin, those are kind of your more common ones that are out there that you'll hear people using that tend to be successful. And it's kind of interesting around medications too. There's been times when I have a patient, and again, I wish I could go back in time because I know there's been patients that'll come in and go, it's funny, my doctor prescribed me an antibiotic for my sinus infection, but yeah, all my digestive stuff went away. And I remember when I was young going, wow, that's kind of cool. I don't know why. And now I'm like, that makes a lot of sense. They had SIBO, so they took an antibacterial and their symptoms went away. But the problem with like these medications and kind of the traditional medicine view of this is that those symptoms you can have SIBO that comes right back. And so you even see this in the literature where they gave somebody a medication, they had improvements, and then like 2 to 3 months later came back. Well, why is that? Well, that's because you didn't address the cause. You didn't figure out what that cause was, or you haven't got to the cause. Maybe you have 5 different causes and you haven't reached number 5 yet. And that's where that struggle comes in again. So maybe there's a brain-gut connection. Maybe there's a thyroid issue. Maybe there's some stress. Maybe, you got a family issue going on that is making some of the SIBO symptoms come right back. And that becomes a hard part. So this is why you'll hear if you're reading research or Googling that, yeah, you can do these symptoms, but they tend to come back. Well, they do because there's still something going on. Or if somebody is just, let's say somebody has a very stressful marriage, and every day is a struggle and every day is a battle, then we can do all the great work, but you're back into that stress environment. And this is why we have a counselor, so that we can help, like, how do we mitigate some of that stress? How do we handle some of that? What can we do to help, the spouses with their stress response, if that makes sense? So this is, again, where it kind of gets a little bit complicated. And then I gave you some of the neurological areas to support. So frontal lobe is a big one, vagus nerve, and then part of that brainstem. Now, there's some really cool things that you can do from a vagus nerve stimulation point is we can do things like gargling. So you can grab some warm water, and in the mornings and evening, you can gargle kind of forcefully with warm water, where it's kind of like bubbling out of your mouth a little bit. What that does is it activates the vagus nerve. You can also do some humming. So you can do that loudly in your car, in the shower, if you're by yourself. If you want to be around people, that's great. But forceful humming will activate your throat and activate that vagus nerve. Sometimes we tell people they can gag themselves, which is always kind of fun. So sometimes you can take your toothbrush and you can gag yourself, and gagging will activate that vagus nerve as well. And then you can do some deep breathing. So you can do some deep breathing that's in your nose, out your mouth, and you can work on just increasing oxygenation. But your breathing is actually part of your brainstem as well. So you can really kind of utilize breathing and breath work and meditation types of works to actually activate the brainstem and see. And it's not only good for stress, and it's good for the frontal lobe, but it's good for your vagus nerve. There's exercise I gave. All right, and then mental health. So I mentioned this, and this is why we have Jake in the office. Is mental health is a big issue. I mean, if you have a stressful job, stressful marriage, if you have issues with family dynamics, these things can wreak havoc. So most of the counselors, this is kind of what's great about having a counselor. If you don't have one, and you're really struggling with this, these are pieces that could be really beneficial. So I kind of put on there counseling, mindful meditation, EMDR. If you're not familiar with that, I think Jake actually did a whole webinar on EMDR, so you can go back to YouTube and watch that. Stress reduction techniques. Those are all things that are really important, but sometimes, with counseling, it's always like you have to get to the root cause. And again, just like SIBO, that can be super hard. I'm sure the counselors would think, man, if I could just figure it out in just 2 or 3 visits, man, life would be great. But usually a lot of these issues, and especially working with patients, is we're all kind of like an onion. So you just peel back those layers, and you're constantly peeling them back to kind of get that root cause. And this is what really gets tough. So there are some patients that you just do 1 or 2 things and they sing their praises, and we're putting people up on the success board and dance around the office. And then there's other people, I'm like, oh, well, there's another layer of the onion that we took off. Here's another one that we took off, and so forth and so on. So mental health support is really, really, really important. All right, so here's your conclusion. Now, one size does not fit all. I mean, oh my gosh, I wish. It'd probably save a lot of research and reading and going back through patient files, and if one size fit all. So that's just not the case. So I think when you're looking for practitioners, if they have the one size fits all, I'm just not too sure if that'd be a great fit, or maybe inquire about that. Like, what is their one size? If they're just dropping the antibiotic and anti this, anti that bomb, yeah, sure, that would work. But are they getting to the root cause so it doesn't come back? And that's the hard part. Each person responds differently. I think that's, again, I'm not trying to be a Debbie Downer. It's just like that's just what can make this really tough. But each person does respond differently because there are different contributing factors. So one person has thyroid issues, another person has gone through menopause, another person has PTSD. So those are different causes, so they have a different treatment plan. And then just know that it can take a while. So, again, some people are really quick to respond. Some people take a little bit longer to respond, but just know that it can take a while. And sometimes patience is kind of part of the game with SIBO. But I think as long as there's good communication, then it should make it a little bit easier. And like anything, if you can kind of see light at the end of the tunnel and you're getting a little bit better and a little bit better, then you want to hang your hats on those pieces. And I think that's what we do too. So those are some of your conclusions. So next steps. So we always offer free 30-minute consultations if you want to learn more about us. So there's us. If you're not on the radio, say KLZ, 100.7. So we're on the radio every Monday. So we all take turns. I was talking on the radio yesterday. I think Dr. Maynard is next actually on the radio. So you can listen to him next Monday from 12:30 to 1, and then he'll do his webinar. So if you really love a topic, you can listen to the radio version, and then you can listen to the webinar version. And then we also do articles on this too. So we're trying to give you guys as much information. So don't forget to go to our blog. We got a Facebook page. We have Instagram. We're everywhere right now, trying to give you guys information so that you can learn more. So we just want our patients to be educated. So we also do telehealth. So if you guys need telehealth, that's also available. And finally, that's us. So I think kind of looking, no big chats, which I guess is good. So I either overwhelmed you, made you cry, or I did a great job. Is SIBO, yeah. So if you have questions on SIBO, always holler and ask. And I hope you guys like this. I really try to condense a 2-hour presentation into 45 minutes. I think that's it. So I hope you guys have a great night. Oh, cool. Thanks. I'm kind of reading anything. You guys are awesome. So it's always great to have you guys on here. So yeah, you can always go back and listen to this on YouTube and record it. If you want the recording, I know we can also do that. Just contact Ruth or anybody at the front office, and then we can get you the recording. So I hope you guys have an awesome rest of your day. And thanks for being a part of our webinar. And we'll talk to you soon. We'll see you for the next one next Tuesday. Have a great one, everybody.